Hello people, I'm Dr. Pepple. This is Dr. Pepple Lifestyle Channel. Welcome to my channel. Today I'm going to be discussing specialty training in the UK and how to get into specialty training for doctors who are abroad and even those who are in the UK. Recently, this resident labor market test has been lifted so that international medical graduates who are intending to go into training in the UK can apply at the same time with British nationals, European Economic Area nationals as well. Previously, the British nationals and the EEA applicants used to apply for the first round, and the other nationals, the international medical graduates, can apply in the second round. And also there seem to be some limitations in specialties that people other than EEA and the British nationals can apply for. But right now things have changed, so there's an equal opportunity. That might be one of the benefits of Brexit. Let's watch and see. But there seems to be an equal opportunity now for everyone to apply at any rounds for specialty training into any specialty, any discipline at all of your choice. And it is for that reason that I'm doing this video, and I hope this is going to be helpful to someone who's planning to practice in the UK, who is planning to go into residency training, as it's called abroad, but here it's called just training. And before I go into the nitty-gritty of the whole matter, I just want to let you understand that there are basically two types of specialty training in the UK. There is the run-through program, and there is the core specialty training program as well. I'm gonna go into this one by one and explain other details. Just sit back, relax, and enjoy this video. The run-through program is actually for specialties such as radiology, clinical pathology, ophthalmology, general practice, psychiatry, obs and gynae. These programs are called run-through because when you get your national training number, you get an offer and you start the program. You basically run through until you finish your training. The core specialty training program applies to specialties in medicine and in surgery, where you go through the 2 to 3 years of core training. After that, you need to apply again for subspecialties in different, for instance, in medicine, where you apply for subspecialty in acute medicine, in endocrinology, cardiology, respiratory. In surgery, you can apply for general surgery, cardiothoracic surgery. So that will be at the ST3 or ST4 level, where you now become a registrar. So these are the basic differences between these two programs. There is also the ACCS route, which is the acute care common STEM, which takes you into training, emergency medicine, anesthesia. Now the question is, what specialty should you apply for? It's actually not in my place to tell you what exactly you should apply for, but you have to consider the peculiarities of the UK work environment and training here, especially for international medical graduates. So there are several things you have to consider. The duration of the training. Most training in the UK are for minimum of 7 to 8 years, apart from general practice, which is 3 years, and psychiatry, which is 6 years. You consider your age and how many more years you want to invest into further training. You could have family responsibilities, especially for female, what age also you want to start having your family. You consider financial rewards and remuneration, lifestyle, work-life balance. Then most importantly is your passion for what specialty you want to go into and the fulfillment you will get, and some other personal reasons. So many people are confused on what specialty to apply to, and some people already know what they should do from their mother's womb, but if I want to advise you, I would say you should filter the specialties that you don't like. When you do that, you're left with the ones that you most likely will consider if you get an offer. So because personally I believe that the choice of a specialty, especially since it's going to be a lifelong job, should be one that you have the appropriate skill sets to perform, and it gives you the opportunity to enjoy your life and also to enjoy the work you actually do and not to burn you out. So the other thing you need to consider is the competition ratio. Competition ratio basically is the ratio between the number of people who are applying for a particular position and the spaces available. There are some specialties that the competition ratio is quite high. Some other ones are very, very low. From the competition ratio for 2018 released, general practice has about 1.3, internal medical training has about 1.5, core surgical training has 2.9. So you can see the range of the competition in these specialties. Before you even consider applying for specialty training in the UK, you don't need to necessarily have worked in the UK. What qualifies you is to have a valid GMC registration, which is what you should have gotten from either, if you get it from the PLAB route, taking the PLAB exams. I've done a video on how to get into the UK work environment for doctors, what you need to do, preparation and the exams and the various routes available. If you can check my previous videos, I'm sure that will benefit you a lot. You can familiarize yourself with the person specification for more information on what particular specialty you want to go into. For most specialties, it's basically 3 stages to get into the specialty. One is the online application, the second one is examination, and the third stage is interview or presentation for some specialties. It's important to understand that entry level for most of these specialties is CT1, ST1, or some might be ST3, CT3 level, which is the registrar level. For the ST1 entry level, you must have completed your foundation year 2 program, which is F2 program. But if you're coming from Nigeria, from India, from Pakistan and abroad, your house job is equivalent to the foundation year 2 program. So all you need to do is to fill up a CREST form, which is one of those requirements you'll get on the Oriel platform. CREST is basically the certificate for readiness to enter into specialty training programs. So this can be signed off by a consultant you've worked with for about 3 months and not more than 3 years. Then you complete your application on Oriel, which is online. After this process, you will be longlisted for the exam proper, the MSRA exam, which is a multi-specialty recruitment assessment exam. So this is an exam similar to the PLAB exam which you've done before. It comprises of 2 sets of exams: the clinical scenario questions, which is about 60 questions over 110 minutes, and the professional dilemma questions, which is about 100 questions in 75 minutes. There are useful materials which you can use to prepare for this. You can get materials online, e-medical, past medicine, past tests, MCQ banks, Oxford Handbook of Clinical Medicine, Oxford Handbook of Surgery, and even the Oxford Handbook of Clinical Specialties. These are quite useful resources. The stage 2, the MSRA, is for most of those run-through programs: general practice, psychiatry, obstetrics and gynecology, and the ones I listed already. Stage 3 is the interview or the presentation stage, depending on what specialty you're going for. But for general practice training, the stage is the physical interview stage, which comprises of 4 stations. One is a clinical scenario station, where you have to rank 5 cases according to the order of priority and also show the management for those conditions. And there are 3 other simulated stations: a simulated consultation station with a patient, a simulated consultation station with a relative, a simulated consultation station with a healthcare assistant. For other specialties, it's a bit similar but with slight differences. For instance, in obstetrics and gynecology, there are 3 stations. There's an interview station, which in some other specialties like in psychiatry and in surgery is called the portfolio station. So this is where you are facing a panel of 2 and they ask you questions ranging around your interest and commitment to the specialty. They ask you some questions relating to research, audit, extra qualifications you've got, your strength. So they ask you questions just to assess how suitable you are for the position you are applying. I think it's the same thing that goes for psychiatry, but it's a bit different because in psychiatry it's actually a portfolio station where you have to show evidence of whatever you're claiming you've done. So if you say you've done research, you need to show evidence for it. If you say you've done audit, you need to show evidence for it. So what our advice is, people who are planning to go into training should start doing at least an audit. An audit will involve you identifying if there's a problem, identify how to match up this problem with set standards, and you collect data, you analyze this data, and you make recommendations, and you go through the audit, completing the audit cycle, and you get to present this and you get a certificate. It's simple and straightforward. So all this will increase your chance and likelihood of getting the training position. If you've got any teaching experience, you can start teaching medical students who come into your ward or your unit for rotations. Teach them about something that is relevant to their training and get them to sign an assessment form for you. So all this will be evidence to show that you have demonstrated teaching ability, leadership. If you've got any prize, any award you won in medical school, whatever it is, if you've done some volunteering work, if you've done some humanitarian jobs as well, all this you compile into an evidence form and present it in your portfolio stations. When you do all this, you're increasing the likelihood of you getting picked. These are the various things that you need to know to prepare yourself to plan towards specialty training. The application window is still open, so you go through, familiarize yourself with whatever specialty you want to go into. Go to the Royal College website of that particular discipline, read more about it, and make your application straight away and start preparing. There are books, there are online resources which you can use. I already mentioned some of them in this video. And yeah, keep the ball rolling. Thank you for watching. Please, if you haven't subscribed to this channel, I'd like you to hit the subscription button, which is just on the lower right hand corner, and the bell notification is just up there as well, so you will be the first to know when there's a new video. Thank you for watching. Drop some comments, suggestions, questions, and connect with me even on Instagram. It's Dr. Pepple, and I will see you again next time. Bye.